weakness in the glute muscles. So sometimes when glute is weak, no, when they are lifting leg, no, they will try to create more pressure from the opposite side. In the hip flexion and extension, both conditions, if the muscle are the weak, the patient is trying to create the more pressure from the opposite side. And the patients are doing this one, and they are creating pressure from the here. So maximum times when they are doing like flexions, they will create the more pressure from this side. With the same, you can take hamstring also. Okay, so how we will check? First we will check hamstring. Patient is lying down like this. Okay, and we are checking hamstring, not a specific muscle. Whole group, because for the hip extension, we are checking the whole group of the hamstring is responding. Okay, so what we'll check? We'll check whole group of the hamstring, which is straight foot, like this. Okay, so if the hamstring group is weak, no, in this condition, if hamstring group is weak, then patient will lift his hip like this. Okay, when they will flex hamstring, they will lift hip like this.
So that means
Then what muscle are they using?
That means the hamstring is weak. Hamstring group, the support of the hamstring group for the hip extension is very weak.
So they are using the front muscle to bend.
Okay. Now, if hamstring is not weak, then try to tell the patients bend your knee and lift your hip. When they are lifting the hip, now check. Okay. So after lifting the hip, if you are pressing, there is no strength. There is not enough contraction. That means there is weakness. If you are giving a little bit pressure, patient is not able to lift the hip. Okay, that means weakness in the glute muscles. So maximum times when glute is become the weak, then pressure, the more stiffness will go toward of
Hip.
if the glute become the weak.
Source of is at the top of the ilium. Top of the ilium.
Hip joint is the center joint of the knee and the lower back in the lumbar region. So then the excess stiffness will travel both sides. If this part become the weak, no, you will use the more these muscles too, and you will use the more these muscles. Okay? And what the patient will complain is having the pain from the here and here, like this whole part. Pain is here also and pain is here also. That is comes from your glute muscles. Understand?
Yeah.
That is why you said there are 4 layers, 4 stages, 1, 2, 3, 4.
Okay. So we target to be needed 75 centimeters is needed in the glute muscle and use the proper element.
Okay.
Okay?
So you're not finding any trigger, you're just
Not possible.
yeah.
It is very broad muscle.
Yeah. So you just
So mostly trigger point you will find more only on the knee flexion and knee extensions and little bit of the gastrocnemius muscles. Which is these two muscles are more strengthening muscles. Okay. And on upper, what we discussed on the upper this part, we'll check the movement. The strength will check here, the weakness and stiffness will check on these muscles. For this muscle, we check the flexibility and range of the motions. What we change in these muscles? Range of the motions.
yes.
Okay? And upper will check the balancing. That will come later.
And for example, if a client comes here and say, "Oh, I'm feeling pain in my hips,"
My hips.
and then you need to check everything, right? Like the psoas,
No, you don't need to check. Where do you feel the
Where do you feel
So,
hip
if you are going to check each and every muscles, there are like 20 muscles. Person will get tired, oh my body is too much exercise.
sorry,
Yeah.
can you please?
Okay, so there are around like 10-15 muscles around the hip. So person is saying, I have the pain hip. How will you check the all muscles? So ask them more questions. Okay, where do you feel the pain mostly? Because each and every muscles they have a different location for the pain. For example, iliopsoas pain is going in the groin. Okay, hamstring pain is coming in the below the buttock here, and glute pain is traveling here. Okay, when we come adductor and abductions, then there is different pain. Okay, we'll ask question, where do you feel pain? Then second, in which position do you feel pain? When the people are sitting like this, cross leg, that time, or you are sitting on the chair that time, or when you get up that times, in which positions you feel pain. So as per that, we'll do that only specific muscle exercise. Okay? When we cover these two, then you will understand where is the problem. Like how you understand knee pain. Versus medialis, pain here. Versus lateralis, pain here. Versus intermedialis, pain inside. Understand? So exactly same. When we cover the four group of the muscles, then you will understand that pain is comes from where. With each and every muscle, pain location is different.
And if the pain comes from the rectus?
Rectus will go here. Your pain is rectus pain. Okay? Rectus
Rectus
pain will go here. And the iliopsoas pain will go in here. Okay? Yeah, but,
In the back of the knee.
back of the knee.
Yeah.
Where here.
Yeah.
That pain is comes from your gastrocnemius. Yesterday we discussed gastrocnemius is attached with here. That pain is comes from gastrocnemius because connected with three bone. The gastrocnemius muscle is connected with three bone, and the soleus muscle is connected with two bone. Then that pain will travel toward of the heel. Okay? Yeah, hamstring muscle is connected with three bone. The mostly hamstring pain radiate toward of the hip only, which is the below the glute in the buttock here. They will press like this, and you're having some pain here. Understand?
And three of them with the pain will be radiated there.
Yeah, because the three are connected with here. So three muscles
You
are.
are going to send us some,
Yeah, I'll send you it.
please,
Yeah, I'll send
because we want to do some.
you. Okay. So in the fifth day, in the revisions after the class, what we'll do, we'll start one by one. If this muscle become the weak or stiff,
Yeah.
where we feel the pain. This is the pain, here pain, here pain. So once you will do,
Yes.
on Monday again we have the revision exam. Okay, who will pass that revision exam will give some gift for those people. Okay, 25 lessons, which is selecting options. Okay, so for example, which are the muscle in the knee extension? So I'll put the 2-3 muscle like vastus medialis, intermedialis, vastus lateralis, and biceps femoris. So of course biceps femoris is not here. And in second option I will give the rectus femoris. So which is the four good, you have to mark that.
One
That's
has
very,
been already.
that's very good for your revision. Okay? Yeah? All done?
Yeah.
If anyone having the iliopsoas, then we can do one practical, otherwise we'll go a little bit on the slip disc or
Iliosoas pain, iliosoas.
iliopsoas.
That means pain here. You don't know. You had it once.
I had it before, I don't have it anymore.
He doesn't want to be
Last
bothered.
year I had it.
After this treatment, no more pain.
No. Nobody had it. Everyone suddenly perfect.
When we are lying on we are trying to sleep.
Oh, you did? You had pain.
You feel very exactly.
All of them are doing
I'm very tight.
So the adductions group and abductions will we will go a little later after we go on sleep disc, and the transactions because we have more case of these,
Yes.
so you can do practice more in the evening because you will not find many case of the abduction and adductions because we are not using that much there, no, we are using more flexion and extension. Okay, so yeah, there is some case where abduction and adduction are connected. Okay. Let's go on sleep disc, which is the very common nowadays. Sleep disc is going slowly.
Also, disc degeneration.
Yeah, disc degeneration mostly connected with your internal organs.
Oh.
Okay, so whenever your liver become dry, Okay, liver become dry due to excess carbon dioxide gas circulations. So there is, there is two problem happen. If there is excess circulations, okay, they will create more dryness. And there is less circulation, they will create more congestions.
Okay.
Understand? So in the liver, if there is excess CO2 circulations, okay, in that body, liver become the dry. If liver become the dry, liver is not able to absorb liver taste. Okay, each and every organ they have their own taste. Okay, so if liver is not able to absorb the taste, then liver is not able to produce the taste. For example, liver taste means the bitter taste. Okay,
Taste.
Okay,
Okay.
so liver is absorbing the bitter taste. So when the liver becomes the dry, liver is not able to produce that bitter taste. Okay, in the bitter also there is different chemical formulas. So liver's formulas, when liver is not produced enough bitter taste, that not comes on your, that all chemicals not comes on your tongues. So if you are eating anything, okay, if you are eating anything like vitamin C or regarding to vitamin B complex, okay, so if you don't have that chemicals on your tongue, when you will eat, then that not mixed with the with taste, with not saliva, okay, then it will go in your body will not absorb that.
Oh.
Okay, so when you eat, you are eating enough, but your body and your liver is not absorbing that, because first process not happen. Okay, so in this is the very worst conditions. For example, when liver is dry, people eating the more amla and they having the more skin issues and different symptoms. But mostly, as per as a traditional therapist and who was practicing like this, uh, if there is a dryness and if you are eating the same chemical on that, then of course your body will not absorb that. And then excess amount of the without absorbing chemical when enter in your bloodstream, they will create lots of problems. Okay? So what they do, they give some treatment to reduce the dryness.
Okay. Then you.
Yeah, when the dryness will reduce, the liver is able to absorb that chemical. Then everything becomes normal.
So how do you reduce the dryness then?
Yeah, that will learn. Okay. Yeah. So when liver when liver become dry, so liver is not able to absorb specific vitamin C. Okay, and vitamin C is produce collagen. And what we require the maximum amount of the collagen in the disc. Okay. Then the disc become the whole disc become the dry. Now we are using disc each and every day. Okay, we are using the disc, but there is not new structure and a new chemical or a nutrition protein receiving in the disc. So we are using that part, but there is not extra, the new growth. So slowly this will start to reducing in the size. Okay. So we have like the proper subject. We'll go into depth in tongue diagnosis only. So that is mostly connected with your internal organ. Okay. What we are discussing, that is the physical. One muscle is stiff, one muscle weak due to your lack of exercise, excess exercise, wrong positions, many things. Okay. So first we focus on this. When we talk
So
about
Daimai that we were doing
Daimai help a lot.
will help, right? Daimai is the one which works on the.
Daimai help a lot to cleanse liver.
Okay.
What were you saying about the bitter taste? Like bitters are good for the liver, yeah? Like bitter food, yeah? Is that what you were saying? It helps to get rid of the dryness.
Sorry. Can you repeat that? What was that?
Bitter foods are good for the liver, like milk thistle.
So see,
What's the
Yeah,
name of
if
that vegetable that you guys
The
have
green
here?
one, is
A
it?
green one looks like a cucumber, but like
Tori.
It's it's called Karela or
Bitter gourd.
Bitter
Bitter
gourd,
gourd,
yeah.
bitter.
so
And
see,
artichoke.
if you eat that, it's good for you.
so again in the taste there is different condition will come. Okay. Again, when we come on the light gas, to reduce gas, there will be different tests. To reduce fluid, different. To reduce acid, different tests. So we'll discuss about that.
So to reduce
So vitamin C
gas.
is like orange is good. Okay, amla, this amla is good. Lemon is a little bit good. Okay.
For what?
Vitamin C.
Oh, vitamin C. And to reduce the gas.
You tell us.
'Cause
Future classes.
yeah.
And the best things, what is your organ is producing, so that same organ is designed by the same product only.
By the same?
Oh,
Product. The same vitamin and mineral.
Right.
so whatever it's producing, it needs as well.
For example, what is function of the heart?
To pump the blood around.
To circulate the blood.
Yeah.
You know that maximum amount of the blood is going around heart only.
Yes.
Yeah.
There is mild blockage, we have the issues. In the many organs, there are 80% blocked, but still they don't have that much of the big problems.
Mm.
Understand?
Yeah.
What organ is designed, or function of that organ is designed by the same product only. Try to come 1:30, okay?
Shall I go tell her?
I'll call you. I have a number.
Yeah.
Okay? So, we have a very big journey. 1 month is equal to your 5 year journey. Okay? You just support me to focus a little more. I'll support you to give more deep informations. Okay? This is the bonding. How deep we can make the bonding,
Yeah.
we'll go that deep. You don't take too much stress, because what happened? The best way to learn, when we are reading the book, no? We are reading something vitamin C, then we are going searching about vitamin C. Already they explain about vitamin C in next chapter.
Wait.
So if we are wait for that, once we read the book, no, then we understand clearly. So once we clear this subject, okay, like knee flexion, then if you have some doubt, we can go in these. Okay, so one by one, each and everything is connected. For example, how the hip extension is connected with knee flexion. Now you understand very well.
Yeah.
Okay, this is the hip extension, and we are lifting the knee flexion muscles too. Okay, so we'll get and try to do more revision after the class in Saturday, Sunday when you will get the times more. You can do some. You can say some information on the group also. Okay, so revision is more important, because once what you learn, when you discuss, then more thought will come out.
Yeah.
Okay, so that's the more. Each and every week we have the new subject. So what you are going to learn in this subject, please try to clear all doubts till Monday. In Saturday, Sunday, do everything.
Yes.
Then from the Monday after the exam, the subject will change. After that, we will not discuss more about the muscles. We will discuss more about human physiology and tongue diagnosis and these. Okay?
This is Friday.
This is Monday.
Monday.
Address is Monday.
Yeah.
We welcome you to from the exam paper only. Please. No cheating.
Okay. He's coming late on Monday.